I know a lot of patients come to us, especially at the beginning, having in mind that they just want symptomatic relief. As soon as I'm relieved of my symptoms, whether it's headaches or back pain, shoulder pain, as soon as it's relieved, I don't want to see a chiropractor anymore, or I don't feel the need to see a chiropractor. I really believe chiropractic should be used in much different and more diverse ways rather than just for symptomatic relief. Okay, so I really like this chart here. It basically says, there's a 7-year study showing that patients who have had chiropractic for a long period of time essentially have a lot less need for medication. As a chiropractor, we want to try to locate the underlying problem, and by doing that, we want to try to get rid of the symptom to keep coming back. That's the essential part of it. And so relying less need for medication is really essential, because you don't want to keep taking medication long term. It's not good for a lot of other organs, for example, especially kidneys and liver. Okay, so you don't want to build up of and reliance on medication. The other one is less admissions to the hospital. Chiropractic essentially, especially many years ago, was actually used to actually improve the immune system. Okay, because of the immune response, straight after an adjustment, it actually boosts your immune system straight after an adjustment. Okay, and that's being proven through research. And so that's why a lot of times people who have chiropractic for a long period of time, not just for symptoms, but they have maintenance, ongoing treatment, even if they feel great, actually have way less needs to go to hospital because they get sick way less often. All right, and also the need for surgeries. Okay, so you can see through here, 62% less outpatient surgeries. Okay, and I'll say a lot of that is to do with osteoarthritis. Okay, so osteoarthritis happens because the spine, for example, or the knee or the shoulder, you get the osteoarthritic changes because of dysfunction. And so normally you should have good range of motion through all the joints. If one area of, for example, the shoulder or the spine locks up, you will get osteoarthritic changes. Because rather than being able to move freely, it gets stuck, it doesn't move well, it starts to irritate the cartilage, and you start to get, for example, osteoarthritic changes. Okay, and so that's where you start to get the need, for example, hip replacements, because it's a long-standing problem of the pelvis or the sacrum, where it's been there for such a long time that it's worn away at the hip joint, and that's where you start to have osteoarthritic changes. And a lot of surgeries is for osteoarthritic changes. Okay, so you should really look at chiropractic and see it as a whole rather than just looking at symptom-based. Like, it helps with the overall health, okay, not just a symptom. So you could be sleeping better, you will have better appetite, your whole well-being is improved.